Hi, I'm Dr. Jennifer Herrman. I'm a dermatologist or skin doctor at the University of Alabama in Birmingham. Today, we're going to be talking about skin cancer, which is the most common type of cancer in the United States. Come to my office with me and we'll meet a patient to discuss this. Hello, Mr. Hill. How are you?
Good to see you.
Dr. Herrman, nice to see you again.
How are you doing? So the reason I'm here, my wife, she said she saw this spot and she wanted you to have a look at it.
Okay, well good. I'm really glad that you came in. Anytime you have a new spot or something changing on your skin, it could be a sign of a skin cancer.
Well, I don't really burn. I get out in the sun a good bit, fishing and that sort of thing, but it's never been a problem before, so I wasn't really worried about it.
Yeah, well, a lot of people do say that, but believe it or not, skin cancer is very prevalent. So many people are getting skin cancers. Now, 1 in every 5 Americans is going to get a skin cancer sometime during his or her life. So it really is on the rise. I see skin cancer every day. So it is important to have your skin checked to see if there is something changing. And I'm really glad that you did come in to see if there is something concerning.
So am I at risk, or what should I do? What should I do?
Well, we will certainly look you head to toe. But skin cancer, there's different types of skin cancer, and some people ask about, is it really dangerous? If this many people are getting skin cancer, is it really a problem? And it really depends on the type of skin cancer we're dealing with. There's 2 main types of skin cancer. There's non-melanoma skin cancer, and then there's melanoma skin cancer. Now, non-melanoma skin cancers, those are more common. They tend to be more associated with a lot of sun exposure, and they typically, when you see them on the skin, they look like either normal bumps. I have a couple pictures here I want to show you. This is an example of a non-melanoma skin cancer. It's called a basal cell cancer, and this is another type called a squamous cell. Now this one, doesn't look maybe that noticeable. It's kind of a skin-colored bump, but it was new for this patient, so that was something that was changing on his skin. This obviously is a little bit more obvious to most people, but they can be more subtle. Anything on your skin that's new, or anything that turns into a sore that really doesn't heal on its own, that could be a sign of a skin cancer. And the second type of skin cancer, or the other main branch, are the melanoma skin cancers. And these are the ones that tend to be a little bit more dangerous. If we don't recognize and treat these types of skin cancers early, they have a much higher chance of spreading to other places in your body, and that can mean bad news. We really don't do a very good job of treating melanoma skin cancer once they've spread. Now, people ask about, well, how do I know if I have this, or how do I know if I'm at risk? And it's really nice to use this ABCDEs of melanoma. Basically, it talks about things to look for. Melanomas typically look like an unusual mole on the skin, but there's certain things that make them a little bit different from normal moles. Here, the A stands for asymmetry. So if something is not equal on one side as it is to the other side, that means it's asymmetric. So you can see here, this is asymmetric. B stands for border irregularity. So most moles, if you look at your skin, they're nice and round or oval in shape. This one has irregular, kind of scalloped borders, so that makes it a little bit more suspicious. C stands for colors. Now, melanomas tend to be multiple colors, where moles are usually just one solid color. D stands for diameter, and so if the mole is bigger than the pencil eraser, that's a little bit more concerning because it's greater than 6 millimeters. And finally, E stands for evolving. Anytime you have something changing on your skin, a mole that's getting darker, one that's getting bigger, if it's changing in shape in any way, that could be a sign that it's a skin cancer. So knowing kind of what to look for will make you better at identifying something that might be concerning.
Okay, so what do we need to do now?
Well, we'll certainly look you head to toe to see if there's anything suspicious. So why don't we get you in a gown?
Okay, all right, thank you.
So here are the most important things to remember. First, Skin cancer is now the most common type of cancer. There are more cases of skin cancer every year than all other cancers combined. Second, skin cancer can affect anyone. Even though people with lighter skin are at higher risk for getting skin cancer, anyone can get one. And it's affecting younger and younger patients. Now, melanoma, which is the most dangerous form of skin cancer, is the most common type of skin cancer in those aged 25 to 29, and the second most common type in those aged 15 to 29. So it's really affecting younger and younger people. Finally, remember that if you see anything new or changing on your skin, or you're worried about something, ask your doctor. Get it checked out.